Hello friends, let's study cardiovascular embryology together from first aid 2022 edition. Cardiovascular embryology. Here we will read heart morphogenesis, aortic arch derivatives, heart embryology, fetal circulation, which is very important for USMLE step 1, and fetal postnatal derivatives. So let's start with heart morphogenesis. Heart morphogenesis, first functional organ in vertebrate embryo, beats spontaneously by week 4 of development. Okay, then cardiac looping, primary heart tube loops to establish left-right polarity, begins in week 4 of development. Okay, it's like a loop and left-right polarity is formed. Defect in left-right dynein can lead to dextrocardia, as seen in Carter syndrome. So in that case, heart will be left ventricle will be on the right side of your chest. It's called dextrocardia because of defect in dynein. Okay, then go to the separation of the chamber. We are reading heart morphogenesis, how heart is formed. So we know there are four chambers in the heart, two atrium and two ventricle. Now we'll read atrium. How atrium is formed. Septum primum grows toward endocardial cushion. This is septum primum. This is endocardial cushion. So septum primum grows toward endocardial cushion, narrowing ostium primum. Ostium means a canal. So septum primum will be grows towards endocardial cushion. Second step, ostium secundum forms in septum primum due to cell death. Ostium secundum, uh, ostium secundum. This is ostium secundum. So septum primum grows and a canal is formed. This is called ostium secundum. Ostium means canal. Forms in septum primum due to cell death. Here cell death is occurs, so it becomes a canal. Then septum secundum. So it is septum primum. It is ostium secundum. And ostium primum is in front of the ostium septum primum. And ostium secundum is in front of the septum secundum. Septum secundum expands and septum secundum develops on the right side of the septum primum. Look at here. This is septum secundum forms in the right side of the septum primum. As ostium secundum maintains right to left shunt. This is ostium secundum, so blood goes from right side to left side in embryo. Okay, then septum secundum expands. And this is septum secundum and covers most of the ostium secundum. The residual foramen is the foramen ovale. So this is septum primum. This is septum secundum. Both are septum, and ostium secundum is covered by septum secundum, and a foramen is remain. This is called foramen ovale. Remaining portion of the septum primum forms the one-way valve of the foramen ovale. Okay, so septum primum closes against septum secundum. This is septum primum. This is septum secundum. Sealing the foramen ovale soon after birth because of increased left atrial pressure and decreased right atrial pressure. So after birth, the left atrial pressure increase because of increased systemic vascular resistance and right atrial pressure decrease because of uh, surfactant in the lungs. Septum secundum and septum primum fuse during infancy or early childhood, forming the atrial septum. So it's these two becomes atrial septum. Okay, so we have to know what is patent foramen ovale caused by failure of septum primum and septum secundum to fuse after birth. Most are left untreated. Can lead to paradoxical emboli. What is paradoxical emboli? What is paradoxical emboli? When mm, emboli from your venous system goes into your arterial system. Venous thrombomboly entering the systemic arterial circulation through right to left shunt, as can occur in atrial septal defect. Okay, patent foramen ovary can lead to paradoxical emboli. Patent foramen ovary can lead to paradoxical emboli. Okay, let's go to the ventricle. We have read how atria formed, how septation of the atrium occurs. First, it was a tube, then atrial septation occurs. Then let's go to the ventricle. Muscular interventricular septum forms. Muscular interventricular septum forms. It is muscular interventricular septum. Opening is called interventricular foramen. This is interventricular foramen. Aorticopulmonary septum rotates and fuses with muscular interventricular septum to form membranous interventricular septum, closing interventricular foramen. Okay, this is aorticopulmonary septum. Aorticopulmonary septum rotates. Look at here, it is rotation like S and fuses with muscular interventricular septum, closing interventricular foramen. So interventricular foramen is closed. Growth of endocardial cushion separates atria from ventricle and contributes to both atrial septation. Okay, this is endocardial cushion. Look at here, this is endocardial cushion. So aorticopulmonary septum forms the membranous interventricular septum. Okay, let's go to the growth of endocardial cushion separates atria from ventricle and contributes to both atrial septation and membranous portion of the. So this is endocardial cushion. Endocardial cushion grows and separates atria from ventricle, and it also contributes to formation of membranous portion, which is situated here of the interventricular septum. Okay, so ventricular septal defect, most common congenital cardiac anomaly, usually occurs in membranous septum. Remind it Uh, Ventricular septal defect occurs in membranous septum. Membranous septum forms from aorticopulmonary septum. Okay, let's go to the outflow tract formation. Outflow tract means blood out from heart. We know blood goes from left ventricle to the aorta and right ventricle to the pulmonary trunk. So, neural crest cell migration, truncal and bulbar ridge that spiral and fuse to form aorticopulmonary septum. Okay, we know aorticopulmonary septum helps to form membranous portion of interventricular septum. So, neural crest derivatives. Remind it, neural crest derivatives, aorticopulmonary septum and endocardial cushion. So, we will note, take note here. Neural crest cell derivatives হচ্ছে aorticopulmonary septum and endocardial cushion. It's partial, not full. Partial portion developed from here. Okay. So neural crest cell migration, truncal and bulbar ridge that spiral and fuse to form aorticopulmonary septum. Aorticopulmonary septum then forms pulmonary trunk and ascending aorta. So, what is truncal and bulbar ridge? What is truncal and bulbar ridge? So, we'll find here truncal and bulbar ridge. This is bulbous cortis, truncus arteriosus. So, ridge in here, truncus arteriosus, bulbous cortis. In in embryo, neural crest cell migration occurs in truncal and bulbar ridge. This is truncus arteriosus, this is bulbous cortis. Truncus arteriosus give rise to ascending aorta and pulmonary trunk, and bulbous cortis give rise to smooth part of the left and right ventricle. Remind, pulmonary trunk arises from right ventricle and ascending aorta arises from left ventricle. So, bulbous cortis and truncus arteriosus, neural crest cell migration occurs that spiral and fuse to form aorticopulmonary septum. So, divide both these. Okay, conotruncal abnormalities associated with failure of neural crest cell to migrate. So, conotruncal abnormalities. What is conotruncal abnormalities? Conotruncal abnormalities. This is truncus arteriosus, this is bulbous cortis. Okay. So, if neural crest cell fail to migrate here, neural crest is derivatives of ectoderm. We know all the structures in our body derived from three parts: ectoderm, mesoderm, endoderm. From ectodermal neural crest, aorticopulmonary septum and endocardial question comes. Okay, conotruncal abnormalities. Conotruncal abnormalities associated with failure of neural crest cells to migrate. So, what are the abnormalities can arise from here? Transposition of great arteries. We know great arteries are ascending aorta, pulmonary trunk. Tetralogy of Fallot and persistent truncus arteriosus. What is truncus arteriosus? Okay, blood vessel coming out of the heart, that is pulmonary trunk ascending aorta. This is truncus arteriosus. Truncus arteriosus give rise to ascending aorta and pulmonary trunk. So, if truncus arteriosus, persistent truncus arteriosus means blood vessel fails to separate completely, leaving a connection between the aorta, a connection between aorta and pulmonary trunk. Why? Due to failure of separation. Okay. So, so let's go to the valve development. So we have read outflow tract formation. Valve development, we know heart have four valve, aortic pulmonary valve. These are and mitral or tricuspid valve. So aortic or pulmonary valve derived from endocardial question of outflow tract because we have read endocardial question separates atria from ventricle. So it is normal to be uh, aortic or pulmonary valve to be derived from endocardial question of outflow tract. In case of mitral or tricuspid valve, derived from fused endocardial question of atrioventricular canal. Here we have read growth of endocardial cushion separates atria from ventricle and contributes to both atrial septation. So it also gives rise to mitral and tricuspid valve. Okay, valve anomalies may be stenotic or regurgitant, athletic tricuspid atresia, or displaced Epstein anomaly. What is Epstein anomaly? Epstein anomaly, displacement of tricuspid valve leaflet downward into tricuspid valve leaflet downward into right ventricle, associated with tricuspid regurgitation, accessory conduction pathway. So, Epstein anomaly can be caused by if mother is exposed to lithium. Lithium is an antipsychotic drugs. Okay, let's go to the aortic arch derivatives, which is very important for your exam. First aortic arch, part of maxillary artery. First arch is maximal. Okay, branch of external carotid artery. Maxillary artery, branch of external carotid artery. Okay. Second, stapedial artery and hyoid artery. Second, stapedial and hyoid artery. Remind to this by bone. We have maxilla in our face. So, first arch from your face, maxilla. And external carotid artery supplies outer portion of your head. So, it will be derived from external carotid artery. Then you have hyoid bone, and I don't know what is stapedial artery. Let's see what is stapedial artery. Okay, this is your external carotid artery. This is maxillary division. This is internal carotid artery. So we have seen here stapedial artery comes from internal carotid artery. Okay, stapedial artery supplies. Which structure supplies stapedial artery? Heparin. Okay, stapedial artery is an embryologic artery that allows the development of orbital and dural arteries. That means in your orbit and your durameter. Okay, so stapedial and hyoid artery. Second, okay. Then third aortic arch derivatives. Third aortic arch, here it is blue color. Third aortic arch derivatives, common carotid artery and proximal part of common carotid artery. This is common carotid artery and proximal part of internal carotid artery. Proximal part of internal carotid artery. Okay. So, we know stapedial artery comes from internal carotid artery, but it is from distal portion. Common carotid and internal carotid comes from third aortic arch. Let's go to the fourth aortic arch. On left, aortic arch. On right, on left, aortic arch. Okay. On right, proximal part of right subclavian artery. Proximal part of right subclavian artery. We know from aortic arch arises three structured brachiocephalic trunk, common carotid artery, left common carotid artery, and left subclavian artery. In this case, aortic arch comes from fourth aortic arch on left side and on right, proximal part of right subclavian artery. Sixth aortic arch, proximal part of pulmonary arteries. On left, only ductus arteriosus. Okay, and ductus arteriosus. Sixth arch, pulmonary and the pulmonary to systemic shunt through ductus arteriosus. Okay, so how you will remember aortic arch derivatives? From your upper portion of body comes slowly to your heart. First, in your face, part of maxillary artery, first aortic arch derivatives. Second, stapedial artery and hyoid artery, which are branches of internal carotid artery. Then, proximal part of internal carotid artery and common carotid artery from third aortic arch. Then go to some descending towards descending portion. Fourth aortic arch comes from aortic arch and proximal part of right subclavian artery. And sixth aortic arch comes from pulmonary arteries and ductus arteriosus. Okay. So remember here is no fifth aortic arch. And a tricky question, right recurrent laryngeal nerve loops around product of fourth arch. Right recurrent laryngeal nerve are the branch of vagus nerve that is parasympathetic loops around product of fourth arch. And left recurrent laryngeal nerve loops around product of sixth. Left recurrent laryngeal nerve loops around product of sixth arch, ductus arteriosus. Ductus arteriosus closes after birth. Okay. Recurrent laryngeal nerve supplies the intrinsic muscles of larynx. Embryonic structure and their derivatives. So, truncus arteriosus give rise to ascending aorta and pulmonary trunk. Then valvus cordis give rise to smooth part of left and right ventricle. Primitive ventricle, trabeculated part of left and right ventricle. Primitive atrium, trabeculated part of left and right atria. Left horn of sinus venosus, coronary sinus. Right horn of sinus venosus, smooth part of right atrium. Endocardial cushion, atrial septum, membranous interventricular. Endocardial cushion, atrial septum, membranous interventricular septum. Atrioventricular and semilunar valve. Okay. Right common cardinal vein and right common cardinal vein and right anterior cardinal vein, superior vena cava. Is it cardinal vein? Posterior cardinal, subcardinal and supracardinal vein, inferior vena cava. Primitive pulmonary vein, smooth part of the left atrium. Okay. Fetal circulation. Blood in umbilical vein has a partial pressure of oxygen of 30 millimeter mercury and is 80% saturated with oxygen. Umbilical arteries have low oxygen saturation. In our body, arteries have oxygenated blood and veins have deoxygenated blood. But in case of fetus, umbilical vein 80% saturated with oxygen and umbilical arteries have low oxygen saturation. Umbilical arteries and umbilical vein. Three important shunts in fetal circulation. Blood entering fetus through the umbilical vein is conducted through the umbilical vein. Blood enters through the umbilical vein into fetus. It's conducted via the ductus venosus into the inferior vena cava. The ductus venosus. Ductus venosus into inferior vena cava, bypassing hepatic circulation. Most of the highly oxygenated blood reaching the heart via the inferior vena cava is directed through the foramen ovale into the left atrium. Through the foramen ovale into the foramen ovale is formed from defect of septum primum and septum secundum. Foramen ovale, ductus venosus, umbilical vein, deoxygenated blood from the superior vena cava passes through the right atrium. Right ventricle, main pulmonary artery, ductus arteriosus. From ductus arteriosus to descending aorta. Shunt is due to high fetal pulmonary artery resistance. So three important shunt in fetal circulation. First one is ductus venosus. It is between umbilical vein and inferior vena cava. Second, foramen ovale between right atrium and left atrium, and ductus arteriosus between pulmonary artery and descending aorta. Shunt is due to high fetal pulmonary artery resistance. At birth, infant takes a breath, decreased resistance in pulmonary vasculature. Increased left atrial pressure versus right atrial pressure. Left atrial pressure increased, foramen ovale closes, and then it is called fossa ovalis. Increase in oxygen from respiration and decrease in prostaglandin from placental separation. Closure of ductus arteriosus. NSAID or acetaminophen help close the patent ductus arteriosus. NSAID blocks cyclooxygenase enzyme and production of prostaglandin and help close the patent ductus arteriosus. Then it is formed ligamentum arteriosum, remnant of ductus arteriosus. Prostaglandin E1 and E2 keep patent ductus arteriosus open. Fetal circulation oxygen saturation. Highest oxygen saturation in umbilical vein. Moderate oxygen saturation in arch of aorta. Low oxygen saturation in pulmonary trunk and descending aorta, umbilical arteries, and very low oxygen saturation in inferior vena cava and superior vena cava. Highest oxygen saturation in umbilical vein, ductus venosus. Moderate oxygen in part of the inferior vena cava, descending aorta, arch of aorta. Low oxygen saturation in pulmonary artery, descending aorta, internal iliac artery, umbilical artery. Very low oxygen in superior and inferior vena cava. Fetal postnatal derivatives. Ductus arteriosus forms ligamentum arteriosum near the left recurrent laryngeal nerve. Left recurrent laryngeal nerve loops around, product of sixth arch. Sixth arch give rise to pulmonary arteries on left and the pulmonary tube and ductus arteriosus. Ductus venosus. Three shunt. Ductus arteriosus, ductus venosus, foramen ovale. Ductus venosus give rise to ligamentum venosum, which is situated in liver. Foramen ovale form fossa ovalis between left and right atrium. Umbilical arteries. Umbilical arteries form medial umbilical ligaments. And umbilical vein forms ligamentum teres hepatis, round ligament contained in falciform ligament. Urachus is part of allantois between bladder and umbilicus. Allantois give rise to urachus. Placenta and umbilical placenta and embryo connected via connecting stalk, and this is allantois. From the caudal wall of the yolk sac that extends into the connecting stalk. Allantois urachus, median umbilical ligament. Urachus is part of allantois between bladder and umbilicus.